Thank you everyone for coming. This is a topic, like Lacey mentioned, I love talking about it, and so we have had some conversations, and I was more than excited to come and talk a little bit about the gut-brain-microbiome access, and also how I am treating mental health. So what we're going to do today, I'm going to do a little bit of an introduction. Like Lacey mentioned, my name is Dr. Shylah Schauer. I'm a naturopathic doctor. I originally went to the University of North Dakota. I did my undergrad here in political science and worked on Capitol Hill for several years, wanting to do healthcare reform. I thought my passion was in policy. Later, getting really passionate about science, and I went back to school, came back to the University of North Dakota, did a post-bac in chemistry, and then went to 5 years of medical school in Portland, Oregon. So that is 12 years of undergraduate school. I would not recommend it. It was a lot. But yeah, so I graduated in 2019, and I specialize in gastroenterology, mental health, and chronic disease. Why I'm so passionate about this topic is because while seeing GI patients, I was seeing that a lot of them were having secondary mental health issues. When I was seeing mental health patients, I was seeing that a lot of them were having secondary GI issues. And so this is sort of the interface of where all of that is happening. And so today we're going to talk a little bit about I'll go over some review of the current mental health paradigm, what we sort of think is happening within mental health, some of the causes that we can think. We're going to focus specifically on depression and anxiety today. Review the gut-brain axis, the nervous system, some leaky gut microbiome, and treatments. I'm going to try to go over this as thoroughly and as fastly as possible because I imagine a lot of people have questions and I want to get to more specific questions. So starting off, here are just some basic mental health statistics. I think all of you, or most of you, are in the mental health space, so none of these will be shocking to you. 1 in 5 suffer from mental illness. Anxiety disorder is the most prevalent. 1 in 4 Americans suffer from a diagnosable mental disorder. And 1 in 4 Americans are taking some sort of psychiatric medication, and we're seeing an increased amount in multiple medications in the younger adult population. So I wanted to talk a little bit about what is our current paradigm of what's happening with mental health. So the current model and a little bit of the dated model is something called the monoamine hypothesis. So this is the hypothesis that we need certain neurotransmitters and we're deficient in them, therefore leading to symptoms such as depression or anxiety. This is where a lot of the medications come from, the SSRIs, selective serotonin reuptake inhibitors, SNRIs, tricyclic antidepressants, and so that's the sort of current model that we're working with. Within the last 10 years, we've seen this sort of shift to something not surprising, that there's a complexity of these conditions that are probably rooted in multiple different factors. So this is sort of the new paradigm that we're shifting into mental health, of what can be causing some of the conditions that we're seeing. There's a list of 6 here. I'm going to go over them a little bit more thoroughly, but you'll see the monoamine hypothesis, the neurotransmitters, is still there. The inflammatory hypothesis, which is, I would say, one of the best in that is kind of coming to the forefront on why we're seeing certain things like anxiety and depression. Social psychology, structural and functional brain remodeling, and the HPA axis are all sort of factors that we think about now and why we're seeing some of these symptoms. So I know you're sitting here thinking, well, I came to listen about the gut-brain axis, right? So when we draft this all out, all of these things are happening within the gut. So this is sort of a picture of the brain-gut microbiome. And maybe you've heard of the terminology, the gut-brain axis. I always talk about the microbiome when I'm talking about this axis because this is the sort of interface of how our gut is talking to our brain. And so you'll see here, the main three systems that we're working with for the gut and the brain speaking to each other are the nervous system, the immune system, and the neuroendocrine system. So I mentioned in the previous slide our sort of new model and what we're thinking is causing depression and anxiety, and how we're sort of walking away from the older model of it's just neurotransmitters. And we're kind of moving into this new phase of there's multiple different things happening. So what's going on? So let's see here. So first I'm going to talk a little bit about the nervous system. So maybe some of you are familiar with the vagus nerve. The vagus nerve is a cranial nerve 10 that goes directly from the brain to all these sort of organs illustrated here. We know it a lot from different yoga or breath work. It's sort of our calming nerve. It's that rest and digest parasympathetic nervous system that we need for proper digestion, slowed heart rate, slowed breathing. And this nerve flows, like I said, from the brainstem through all of the GI organs and is sending messages bidirectionally. So there's sort of this thought looking at this picture that the brain is telling everything else what to do. But what we know from the vagus nerve is that the vagus nerve is 80% affluent, meaning that 80% of the signaling is actually going from the gut to the brain. So this is an important concept to think about. It has about, when we're talking just about the vagus nerve, it's about 100,000 fibers. Another huge component in this nervous system communication is going to be something called the enteric nervous system. And the enteric nervous system is the nervous system that lines the gut. So this is the largest periphery nervous system in your body. It's about 600 million units, so it's massive. It can function completely without the brain. So what we found in research is that if you completely remove the spinal cord, the enteric nervous system will function on its own. So this is really important to know because this is giving signaling back to the nervous system on what's going on. And it's doing this majority through the microbiome. So the microbiome is, again, it's making 95% of those serotonin molecules, those neurotransmitters, to communicate to the nervous system. So the immune system was another big system, like I mentioned when we were reviewing. This is probably the top competitor for why we think that we're seeing depression and anxiety. With the neurotransmitters, we know that through our medications like SSRIs, that patients get better. But what the idea is with the selective serotonin reuptake inhibitor is that we're keeping serotonin around for longer, and so that's why people are feeling better. But if that were the case, the medications would be working with the first dose or within the first couple of days. But when we give an SSRI, we know that it can take anywhere from 2 to 6 weeks of using before some patients see results. So this has sort of led to a different arena on how are these neurotransmitter medications working, and it's sort of leading us to a path of creating neuroplasticity within the brain, and so it's actually creating structural changes and is helping patients rewire patterns in their brain, not necessarily just keeping serotonin around the gut. So with this sort of inflammatory hypothesis now, this, like I said, is the hypothesis that I think most people are coming into our office are experiencing. And we know it as an increased sort of intestinal permeability is the medical way of saying it. In lay, people call it leaky gut. And this is too, if you can see on the image, the left side is sort of the normal mucosa, what we want the GI system to look like. And on the right is sort of the worn down mucosa. And if you can see on the normal gut functioning, you have that sort of good bacteria overflow that covers the cells. So this in your gut and in your entire body is always going to be your first line of defense. So if people have had a history of trauma or stress, we know that stress can actually lead to a die-off of the microbiome within 2 hours. And I think anybody who's experienced any sort of stress in their life, there's moments where 2 hours seems like a very short time, right? And so that can also be just as impactful as taking an antibiotic. The food that we're eating is going to have an impact on these good microbiomes if we're taking in the right microbes themselves or if we're seeing an infection. That's all going to play a role on that sort of mucosa as our first line of defense that keeps these cells healthy and functioning. And then what you can see on the right side is that when we have that microbiome, that mucosal lining is disrupted through any one of those things that I just mentioned, the cells actually switch shapes, and their tight junctions that link them together can wear apart, and so things can get into the bloodstream that we don't want. So this is something that I see a lot of. I see it a lot too with things like autoimmune disease. Autoimmune disease, we know there's a genetic component. A lot of times there's a stressor and a trauma component, and those are two things that we cannot control. But the third thing is that if there's any sort of gut dysbiosis issue, that's going to sort of be the trigger that allows for all of these things into the bloodstream that we don't want. And when we're thinking about things like rheumatoid arthritis, that's another big one that can get a sort of leaky gut picture, and I would imagine a lot of these conditions in the future, we're going to be looking towards how can we treat the gut first before we start healing. So that's just sort of a picture of what we want our mucosa to look like and what happens if it goes haywire. So about 80% too of the immune system is in the gut, so that's a huge component that we want to think about. And so it makes sense from the body's perspective, right? If you get an acute cold, what's going to happen? You're going to get tired. You're going to get a little bit depressed. All of these things are normal immune responses to your immune system putting out certain proteins to heal. But what happens is that we have sort of chronic inflammatory response, which is what we don't want, and that's going to keep these conditions going. So if you're seeing a patient maybe more with malaise or you have joint pain, those are all things that I sort of think about what's happening in the gut. Another thing here too, they have on this chart gluten, and I would also put in there's other foods that are just harder for our bodies to digest that can sort of disrupt how we're able to metabolize, and it's going to overall affect our immune system and increase its sort of inflammatory response. Lastly, of this sort of three-phase of the microbiome, the gut-brain axis is the neuroendocrine. This one is the HPA axis dysfunction. That one, again, you probably have heard the more lay way of saying it is adrenal fatigue. So when we're saying hypothalamic pituitary adrenal axis dysfunction, what we're saying is there's some sort of adrenal fatigue from a long-term stressor that's told the brain, is told how we have to make cortisol in response. And that plays a huge toll on the entire body because it's going to affect, again, that inflammatory response, but then also our thyroid hormone and how we're metabolizing our food. So I've seen a lot of patients, and a part of sort of my intake with any sort of symptom, whether it be GI or mental health, is to ask what was going on in your life when these symptoms started. And I have met very, very few people who will say, not much, just sort of average, can't really put a finger on that time. Everyone has a stress, a traumatic event, pressure, even if it's just moving, normal life stressors, that sort of amplify these symptoms. And I think everyone, and to what I like about this new modeling of mental health that we're going to, instead of just this idea of neurotransmitters, is that we're addressing the elephant in the room, that people are complex and people are going to have their own pathological response to stressors. And again, some people, when they get very stressed out, they eat a lot. When some people get really stressed out, they don't eat. And that's sort of an individualized response in how you're going to respond. Let's see here. So, like I mentioned, the microbiome is the sort of interface of how the gut is talking to the brain and vice versa. But I would always argue that the brain, or the gut is talking more to the brain, and people call, the gut the second brain and the microbiome the third brain. I think the gut is the first brain, and it's taking in so much sensory responses and kind of giving us that feedback to the brain on what's going on. And that's sort of where this idea of trust your gut, or gut feeling, right? Because you're taking in all this peripheral information through the nervous system of what you're digesting in the world. I like to think about it too as data. So if I'm, this morning I had a smoothie with pineapple and coconut, and it was wonderful. But what data am I giving my body? I'm telling my body, I live in a tropical climate, it's very nice, and so thinking about it all is sort of data processing. And when people are eating ultra-processed foods, it's sort of a misinformation of data too. It's hard for the body to sort of digest. And that's sort of how I think about it too, is how are we able to digest the world around us from a metabolic level and from an emotional level. And so the microbiome is all the rage right now, as it should be. In the last 10 years, we've seen a huge push to the research in what's happening in the microbiome. There was a big wave for a while in the gastroenterology space of fecal transplants. I don't know if you guys have heard about this. So fecal transplants are done when you have hospital infections due to antibiotics called C. difficile. That's sort of the standard of care. But what they were finding was that in these fecal transplants, they were also able to reverse things like irritable bowel and inflammatory bowel disease. So it was this really exciting research, and it is exactly what you think it is. You take the stool from a donor and transplant it into the colon of the patient. So yes, it is exactly what it sounds. And but they were finding that it was working wonderful for reversing all of these sorts of pathologies. But then what started to happen? What started to happen was that the patients who were getting these donor stools were now developing psychological conditions. So patients who never had depression developed depression. Patients who never had a mood disorder developed a mood disorder. And so this had an abrupt stop on all the rage of the fecal transplants, which, I was so excited about it. I know you guys are looking like you're not as excited, but yeah, so it kind of put this halt to it, and it also put a push towards, okay, what's going on with the microbiome? We know that there's this correlation of how it's affecting mental health, and we need to take a closer look before we continue to do these sorts of treatments. So the microbiome itself is composed of trillions of bacteria, viruses, fungi, parasites, phages, protozoa, anything you can think of, it's in there. For every one human cell you have 10 microcells. So I always like to think about you're just sort of a walking petri dish for the microbes. So thinking about how can we be nice for our microbes because they're nice to us. So the microbiome plays this huge role, like I said, in the nervous system, in the digestive system, obviously, in our immune system. That is another thing too. What we find with the dysbiosis is you're more prone towards acute infections, like the common cold, those sorts of things, can be associated back to how does your normal gut flora look and present. You can see in this sort of chart the things that sort of dictate what makes a healthy microbiome. I think a lot of them are pretty obvious to people. Pharmaceutical drugs, like I mentioned, antibiotics, and again too with antibiotics, we've known for a long time that there's been this correlation with mental health because a side effect that we say to people when we give an antibiotic is could cause anxiety, right? And so there's always sort of been this connection. But there's also other medications like hormonal birth control that we're finding are changing the microbiome and how we metabolize and reabsorb certain hormones like estrogen. And then again, the diet is a huge one. I would say the diet is the number one factor. If you were going to worry about any of these things, especially in the modern era that we're living in, you know, we have the standard American diet, the SAD diet, which is a lot of ultra-processed foods, and you know, we have the USDA coming out saying ultra-processed foods do not cause obesity, and that just seems very wrong. And so I think within that, and you also aren't getting healthy fibers. A lot of people are living in that sort of, you know, systemic. I'm sure you see people like this who have just had chronic stress for so long and they're in that sympathetic state, right? And it's hard to get out of. And when we look at it from the mental health perspective, that's one avenue, but also looking at it from the perspective of when you're in that place, you're not going to digest. So the food that you're putting in, your body is thinking, I want to stay alive, right? And so I don't have time to process this food. We're not going to break it down. We're going to get it in and out. I just want energy. I want to pack on calories. I don't want to use them. Because the body is very smart. And that's sort of been my overall, too, like philosophy with treating any condition is that the body is smarter than we are. And the body is responding to stimuli from something. And so what is it responding to that needs to be altered? And so, yeah, again, looking back at this, diet would always be my number one. Again, a lot of medications, I think antibiotics, you know, for good reasons are criticized when they're overused, but they definitely have their place in time. And I don't think anybody should be avoiding them in a fear of their microbiome. But I do think that there needs to be an intermediate phase after the antibiotic of how do we rebuild the flora. Stress, like I mentioned, within 2 hours, you're going to see a huge die-off of the microbiome. A lot of early phases of life, how you're born, infant feeding. That's again something that I do with all my patients is I have them go through a chronological timeline, starting at birth or even talking to their mother about what was happening in your life. Were you having stress? Were you able to relax? Because all of that is going to set us up for disease later on in life. And those are things we can't control, right? And with the birth process, again, really good times when C-sections are needed. I know when I gave birth, it was knowing everything about the microbiome. It was the opposite birth that I wanted to have for my baby, but knowing that this is what was best for mom and baby. And then we're going to focus on rebuilding the microbiome is also really important because I think, again, like as a mom, there's so much pressure on women to do all of the things. And so if breastfeeding doesn't work for you, relax about it, but also think about what we can do separately to increase the microbiome. Different life stages, that sort of stuff. And I just too wanted to say, here's just a list of current conditions that in the conventional space we know, we have research willing to say are affected by the microbiome and a dysbiosis. Like I mentioned, acute infections, small intestinal bacterial overgrowth, inflammatory bowel like Crohn's, colitis, coronary artery disease, allergies, anxiety, asthma, autism, chronic fatigue, colon cancer, diabetes, depression, fatty liver disease, irritable bowel, liver cancer, multiple sclerosis, neurodegenerative diseases such as Parkinson's and Alzheimer's, obesity, pancreatic cancer, and rheumatoid arthritis. So this conversation has been around depression and anxiety, which are on the list, but I also wanted to showcase everything else that's on the list and why through all avenues of life, I think providers need to be talking about to patients on what's happening in their digestive system and also what they're eating. So when it comes to mental health, there's been this new sort of terminology on psychobiotics. I'm not sure if you guys are familiar with it. So psychobiotics are sort of a group of probiotics or bacteria that has been multiple research on how it's interfacing with our mood and cognitive performance. So I just put a couple on here. There's also a lot of really good research of multiple bacterias working together. But these are sort of the big ones that are pretty common too if you get a formula. I'm not sure if you're looking at any supplements that your patients are taking. But Bifidobacterium longum 1714 on the bottom left there, and that's a very researched microbe. And as you can see, it's been shown to reduce stress, improve memory, reduce anxiety, and work as a sort of antidepressant-like behavior in certain different tests that they use. This was all on mice. So again, I just wanted to showcase this as a little bit of the psychobiotic world and that all this research is out there. And when patients come to me, we're very specific in how we're treating. So I'm not saying, oh yeah, we know that the microbiome is super important, let's throw probiotics at you. So it's very important for me to do a sort of lab testing, especially when you're dealing with patients who've kind of been through the ringer, right? And have a lot of depression and anxiety, because you might have some motivation issues there. And so being very specific with the treatment and what we're treating, instead of saying, hey, these things are great, let's do it, right? Because if you have a patient who comes in who has major depressive disorder, and you tell them all this great research we have about nutrition, probiotics, exercise, which we have, right? But that's not the place and time because they're having a tougher time to motivate to get through the day. So how can we be specific in getting that treatment to get them feeling better, to then get the motivation to put in these other things in place, right? Healthy habits make healthy habits. And so I don't, depending on where the person is at. But yeah, so another one, Bifidobacterium infidus is another one I wanted to talk about just because you can see here it normalizes the immune response and it reverses behavioral deficiencies. This is one, as you can see from the name, that we expect babies to have a lot of. So this one comes from the general sort of mucosa, and the breast milk supports it. So if babies aren't getting breastfed, aren't getting a lot of skin to skin, this one is a really good one that's in a lot of supplementations for kiddos. But yeah, so some of the other ones, there's a long list. I can give you a handout to you later. So going through all of this, sorry, I wanted to talk. So we covered a little bit about the background on the gut-brain axis and what we sort of think is happening. But what does this mean for treatment? And I think that that's a big question. And like I mentioned, the first thing I would always do is a lab test. So there's really good stool samples out there. And these are all going to be functional lab tests. So most patients unfortunately have to pay out of pocket, but they're very thorough and they're going to give us markers for everything that we talked about that could be a possible reason on why we're seeing different conditions. So they're going to tell us what's happening with inflammation. They're going to tell us about what microbes are in there, what's happening with the normal flora. Another thing too, within this sort of microbiome is we want to make sure that there's not an infection. So there's not some sort of microbe that's taken up shop that we don't want there, or a parasite that's stealing nutrition, so we're not able to even make those neurotransmitters. And so a stool sample giving me that information is what I would want to do first, because I always say don't guess when you do test. And we know all of these things that it could be, but I want to be specific with the treatment because that's how you get the best outcomes. And so I always say I love the microbiome, but if people ask me what probiotics I recommend, I say I recommend a stool test. Because if you're not seeing what's happening with your own microbiome, then just throwing anything in there doesn't really help. So that's sort of what I would always recommend, is that sort of testing and looking to see what's going on, what microbes we want to introduce. Because you can be very specific with what you're doing, and you'll see fantastic outcomes with that sort of specificness. The second thing I would always do is I call it self-care, but that's just sort of my way of saying we gotta get your nervous system to calm down. That we need to get that nervous system connecting to the digestion in the head that we're safe. And that I found for people is a lot of different tools. Some of my favorite, I personally, because I can be a little bit a nervous prone person, so things like breath work and those sorts of stuff don't work for me. I need a little bit more of sort of touch, so acupuncture, even like the flow tank. I don't know if you guys are familiar with that, the flow tanks. Gentle massage. You don't want to do something that's overstimulating, but a gentle sort of relaxing massage. Shiatsu, which is a Japanese style acupuncture massage, is also really good because there's an energetic sort of component within that. A sort of, we call it a non-sleep deep rest. It's a yoga nidra practice that can sort of help with that relaxing of the nervous system. So I typically give people a sort of list and say, pick what works for you. And the goal is 10 minutes of self-care a day. And for a lot of people, that can be actually really difficult to find 10 minutes within the day of anything that they want to do. Journaling, listening to music, going for a walk. And I think starting with that is always really beneficial because it can sort of get people to check into other avenues of their life. But that's just always going to be a huge component. And again, this is exactly the treatment I would do for somebody who came in with irritable bowel syndrome or somebody who came in with depression. I would say, okay, what's happening? And again, too, I think you could ask any GI doctor, how many patients have you seen with an inflammatory bowel condition like Crohn's or UC, or even celiac, who weren't having anxiety symptoms? Because those two are really correlated because you have that sort of breakdown of microbiome with those ulcerations. And so things are easier into the bloodstream, which is going to cause a physiological response of stress and anxiety. And I think that's like always what I like to remind people who are kind of going through those difficult times, is that this is a physiological response that your body is having. This isn't in your head, it's likely in your gut, right? But you are responding in a way, we have to figure out what is causing that and resolving it. And then thirdly, supplementation. Like I said, with those certain psychobiotics, looking at what they specifically need. If they're again in that chronic sort of sympathetic state, and they're not sort of able to work themselves down to relax, then they're not going to be digesting. So I would also support from the digestive tract and give some a digestive enzyme. And so what we can sort of think of that is when food comes in the gut, it needs to get processed down before it gets to the intestines, so then the microbes can do their job of picking it apart and taking out the nutrition that we need. And so if we're in a stressed out state, what's happening in the stomach is that food's not going to be processed well. It's like a blender without the blender. And so it just gets dumped through, and the microbes are like, what do you want me to do with this? I can't access the nutrition we need because it's not broken down enough. so we can't even build neurotransmitters. So if that's the sort of problem, I'll focus on how can we support digestion from the upper tract. There's also a lot of good supplementations on 5-HTP, the precursor to serotonin. Again, with that, you need certain nutrients like B6 in order for the microbes to make it. And that's all coming from the amino acid tryptophan, which is in your diet. It's an essential amino acid. That means you need to eat it in order to have it. So if you're seeing patients too who've been chronic vegetarians or vegans, that's always something that I think about too, because that's where you're going to get your tryptophan, is in those animal products. And so how can we get in tryptophan if they want to continue the vegetarian diet, and so they can build those neurotransmitters themselves. And when we're looking at things like the inflammatory response, there's a lot of foods, as you can imagine, that are going to cause inflammation in the guts. A lot of seed oils are pro-inflammatory in nature, and that's why things like fish oil actually work as an anti-inflammatory. And even things like NSAIDs have been used to treat depression symptoms with much success because you can reduce that sort of inflammation. Again, the most important thing of all of these, if nobody wants to do anything, it's always going to be nutrition. And my baseline for nutrition is eat more plants and vegetables. Like, I don't like restrictive diets unless the patient really needs them. But I think so many people are missing out on whole foods. And so by just introducing those fibers, those fibers themselves, we call them postbiotics, and they feed the cells in the intestines so they can stay healthy. So I think just increasing fiber and trying to eat as whole food as possible. I think a lot of you would be interested in the GAPS diet. Have any of you heard of it? So the GAPS diet it's a fantastic book. It's a hard diet to implement. It's pretty restrictive, but it works really well. It was done by a doc who's an immunologist nutritionist whose son was autistic, and through this sort of diet she was able to reverse his autism. So there's a lot of good data on it with autism, depression, anxiety, schizophrenia, and dyslexia. It's a fantastic, and like I said, she's collected all the data on it, so I recommend the book. It's called The Gut and Psychology Syndrome Diet. So that's a really fantastic one. And again, it's all on healing the sort of mucosa of the intestines and reintroducing in those healthy microbes. And so finally too, I wanted to talk a little bit about some of the novel treatments. And I have several colleagues who I've worked with in the past who have been working on certain treatments using different ways of using probiotics. And so one of them is when you get a probiotic, the bacteria is no longer alive. And so this also can cause a problem with repopulating the gut. And so how can we keep the probiotics alive? So we're giving people bacteria, which will probably be an FDA nightmare in all honesty, but that's something that's in the works. Again, the fecal transplants, like I mentioned before, there's a new product out that has found a way to, I think they call them capsules. And so they have a donor and they autoclave the stool sample. And so you take it orally, and it gives you those sort of postbiotics to help you heal your gut that they're finding fantastic results with. And again, I don't think I mentioned this when we were talking a little bit too about the microbiome. Maybe I did, but the microbiome after the age of 3 is very hard to repopulate. So I always, when you see kiddos, want to do everything right away before 3, because at 3 your microbiome is set up and that's sort of where it's going to be. And so it's pretty hard to make significant changes, but if you get kiddos before 3 to sort of set up their microbiome, you're much better results for long term. and avoiding some of those conditions like I mentioned. So this is sort of the basic treatment structure. Just a little bit, I'm kind of running out of time here, but I wanted to talk a little bit about clinical. I forgot to mention, so in the beginning, so in naturopathic school, I trained in Oregon, which we have full prescription rights. So I was working at a mental health clinic for several years, working with side by side with the psychologist. So they would see their psychologist, and then they would come for us for treatment. So I did a lot of prescribing of mental health medications from a lot of different disorders, and then I also had shifts where I was treating more naturopathically, where I was kind of addressing the sort of gut dysbiosis, talking about different things, you know, and treating it from a more natural approach. And what I was sort of finding in those scenarios was the fine balance that it takes to do that, and how both are important depending on where you're at in the sort of spectrum of things. But what I would find from my patients that we would spend time and we would talk a little bit about this gut-brain connection and how we can actually do these things to increase our own serotonin. And we're probably seeing, you know, there's a reason why we're seeing these symptoms, and we can do things sometimes it's along with the medications, where I had a patient who came in and was suicidal, and we started her on an SSRI that day, but I also talked to her a little bit about her depression and these sorts of underlying things that could be going on and things that we could work on later. And what I would find with even having those conversations with patients, again, wherever they were at and what they needed, was this level of empowerment that comes with that. Instead of thinking, oh yeah, you know, there's something wrong with my neurotransmitters, I need medication in order to feel happy, right? Is that when we talk about these things from an empowerment perspective of like, oh yeah, the way that you're, you know, taking care of yourself, the way that you're eating, these are all going to interface in how you feel, and you're in charge of that. Like, this is your power, how it would give people their sort of power back in their own process. And again, depending on where people are at, and I'm sure everyone has known the point in time where, you know, they just need a solution, they don't need a lecture on it. And sort of assessing that, and that's also why I really liked the ability of treating from the prescription to the natural approach, because I could see what people needed and sort of listen to them. Yeah, and so in general here too, I didn't talk about in treatments therapy, and that's because I just think in general everyone needs to go to therapy, no matter what. And so, yeah. Yeah, and so that's sort of the last part of my lecture. I wanted to open it up for questions. I feel like I kind of rushed through it, so please. Yeah, we'll turn off the video.